Here we are, week 5 of this course. This week, we will be discussing the various roles and responsibilities of the athletic trainer. This is a topic that is much more extensive than what we will be reviewing, but I want you guys to have a really good introduction to this material. You will be learning more about all of these responsibilities as you get more involved in athletic training. In this presentation, we will differentiate the roles and responsibilities of the athletic trainer, the team physician, and the coach, define evidence-based practice as it relates to the clinical practice of athletic training, and then explain the function of support personnel in sports medicine. As I'm sure you are starting to understand, athletic trainers must be knowledgeable and competent in a variety of specialties that are housed under the sports medicine umbrella. The specific roles and responsibilities of the athletic trainer differ according to the setting they are employed in, but one thing will always remain the same no matter what. The athletic trainer must work in their scope of practice. The athletic trainer's scope of practice falls within the 5 domains of athletic training. These domains are injury and illness prevention and wellness promotion, examination, assessment and diagnosis, immediate and emergency care, therapeutic intervention, healthcare administration, and professional responsibilities. I would highly recommend that you take notes during this section, as not only will this be on your next quiz, but these domains might also come up during your Troy University Athletic Training Program admittance interview for those applying to the program. The first domain, injury and illness prevention and wellness promotion, can be considered the primary responsibility. The athletic trainer is tasked with the responsibility of minimizing risk as much as possible. This can encompass conducting physicals, ensuring appropriate training and monitoring environmental conditions, selecting, properly fitting, and maintaining protective equipment, proper nutrition, proper medication use, while discouraging substance abuse. Next, my personal favorite, the examination, assessment, and diagnosis. Frequently, the athletic trainer is the first person to see a patient who has sustained an injury. The athletic trainer must be skillful enough to recognize the nature and extent of an injury and then also be able to efficiently and accurately examine and diagnose an injury or illness. It is essential that the athletic trainer be alert and observe, as much as possible, everything that goes on during activity. Ultimately, though, it is the team physician's responsibility for providing medical diagnosis of an injury, so knowing when to refer is crucial. Next, immediate and emergency care encompasses the acute management of injury and illnesses. The athletic trainer is often responsible for the initial on-the-field injury assessment and diagnosis following acute injury. Once this is done, the athletic trainer then must assume responsibility for administering appropriate first aid and for making correct decisions in the management of acute injuries. This translates to off-the-field injury management as well. The athletic trainer must be certified in CPR and the use of an AED as well. The athletic trainer is also tasked with the responsibilities of establishing a well-defined emergency action plan, or an EAP, in cooperation with local rescue squads and the community hospitals that can provide emergency treatment. The fourth domain of athletic training is therapeutic intervention, maybe one of the more popular of the domains. In this domain, the athletic trainer works closely with the team physician to designing and implementing the patient's treatment, rehabilitation, and/or reconditioning protocols that make use of appropriate therapeutic exercise, rehabilitative equipment, manual therapy techniques such as massage, and other therapeutic modalities to better the chances of the patient returning to participation as close to where they were before injury or illness. This is where athletic trainers can really have the most fun. It is also important to realize that during this time, the athletic trainer might play more of an additional counseling role to offer psychological assistance, but more on that in a second. The last and final domain, and maybe the most boring, but really should be considered the most important, is healthcare administration. The athletic trainer is responsible for the organization and administration of the athletic training facility, including the documentation and maintenance of health and injury records for each patient, which we will discuss in a few weeks, the purchasing and inventory of necessary supplies and equipment, also will be discussed in more detail in a few weeks, maintenance and safety of equipment, and, depending on the role of the athletic trainer, the supervision and establishment of policies and procedures for day-to-day operation of the athletic training facility. Not only does the athletic trainer have to take care of their patients, but there are certain other responsibilities that sometimes fall onto the athletic trainer's lap. Just like with other healthcare providers, things such as being an educator or preceptor, counselor, researcher, and all around professional are also sometimes required of the athletic trainer. As the medical field is constantly growing and expanding, the certified athletic trainer should assume personal responsibility for continuously expanding his or her own knowledge base and expertise in the field. This is something that is required by the Board of Certification for all certified athletic trainers and can't be accomplished by attending state, district, and national meetings, as well as reviewing professional articles and research. The athletic trainer is also tasked with getting involved. Making an effort to be professionally involved at the state, district, and national levels can help enhance the athletic trainer's growth and education in the profession. The athletic trainer might also have the opportunity to be an educator, or a preceptor, as it is termed in athletic training education. This requires that athletic trainers keep up to date on the quote-unquote newer education available, which can help the students they teach, but also their own education. Like the preceptors here at Troy, we task them to provide quality clinical education through exposing students to any opportunity, which could mean providing students with the rationale for practicing patient-centered care by teaching them how to incorporate research-based medicine. The athletic trainer should also take the responsibility as a counselor as well. This can mean counseling and advising a patient on prevention and/or treatment of injuries and illnesses, but also counseling coaches and parents on the same when appropriate. This responsibility is perhaps one of the most rewarding aspects of working as an athletic trainer, having the ability to build relationships with patients and your teams. Helping communicate and work through the hard days in treatment, as well as providing an ear to listen and advise your patients in their daily lives. Next, the athletic trainer as a researcher. As the athletic training profession continues to gain credibility as an allied healthcare profession, it is essential that the athletic trainers work to enhance their visibility and credibility by engaging in research and scholarly publications. I'm not going to go into too much detail on this responsibility, but as an athletic trainer, it is crucial that an athletic trainer engage in research, whether doing or reading, for the betterment of their patients as well as themselves and their own education. Last but certainly not least, the athletic trainer should be sure to be professional at all times. There is no field out there like athletic training. The excitement, variety of tasks, as I'm sure you have gathered from this presentation, and personal satisfaction is what gets you up in the morning. An athletic trainer's personal qualities determines their success. Qualities such as stamina, empathy, sense of humor, communication skills, and intellectual curiosity, as well as ethics, are essential to a good athletic trainer. As discussed before, being involved plays a major role in the development of an athletic trainer. Being involved in professional memberships opens up a lot of doors for athletic trainers, so it is a must that athletic trainers find the time to stay involved. Finally, it goes without saying that the athletic trainer has the responsibility of staying in communication with those around them. Because of these vital roles as the main hub, they must develop and maintain relationships with the patient's parents when appropriate, the team physician, the coach when appropriate, and other medical and non-medical support services and personnel. In summary, athletic trainers work within their scope of practice, the domains that we talked about in this presentation. But their responsibilities can vary, but ultimately remain the same depending on the employment setting. I encourage you guys to continue to do research on the fields of athletic training, not only the employment settings that you hopefully will one day work in, but also the different responsibilities that go into the settings.